Hello everyone. Today we will discuss about organ function tests. Organ function tests are medical tests that are performed to assess the functioning of various organs in the body. Common organ function tests include liver function test, renal function test, thyroid function test, pancreatic function test, gastric function test, etc. So first we will see liver function test. Liver function tests or LFTs are used to assess the functioning of liver and to detect liver damage or liver disease. These tests measure the levels of enzymes, proteins and other substances in blood that are produced by the liver. Coming to the classification of liver function tests, first classification is test based on excretory functions of liver. Second classification, test based on serum enzyme profile, and third classification is test based on synthetic function. First we will see test based on excretory functions. Based on excretory functions, two tests are there, total bilirubin and conjugated bilirubin. Bilirubin is an excretory byproduct of heme breakdown. Normal range of total bilirubin is about 0.1 to 1.2 mg per dl and conjugated bilirubin 0.2 to 0.4 mg per dl. High levels indicate liver damage or hemolytic anemia. These are the tests based on excretory functions. Next classification is test based on serum enzyme profile. Here, activity of various enzymes like ALT, AST, ALP, GGT are estimated. ALT or alanine transaminase, its normal range is about 7 to 55 IU per liter. AST 8 to 48 IU per liter. Then these high levels of this ALT or AST indicate liver damage. Then GGT or gamma glutamyl transferase, it is about 5 to 40 IU per liter. Elevated levels of this gamma glutamyl transferase enzyme indicate liver disease or alcohol abuse. Next enzyme is ALP or alkaline phosphatase, which is about 44 to 147 IU per liter. These are the tests based on serum enzyme profile. Third classification is test based on synthetic function. Two tests are there, albumin and prothrombin type. Albumin is the major protein in plasma which is synthesized by liver. Normal range is about 3.5 to 5 gram per dl. If level is below 2.5 gram, it indicates liver disease. Next one is prothrombin time or PT. Thrombin is one of the clotting factors which is produced by the liver. Normal, it is 9.4 to 12.5 seconds. Blood clotting takes longer in case of acute liver disease. So these are the tests based on synthetic function. Coming to the clinical significance of LFT. LFT is for detection and screening of liver disease, then monitoring of liver function and diagnosis of liver injury. So that is about liver function test. Next we will see renal function test. Renal function test is used to assess the functioning of kidneys and to detect kidney damage or kidney disease. It measures levels of various substances in blood and urine that are produced or excreted by the kidney. These tests include first one, blood tests. Blood tests that measure the levels of serum creatinine and blood urea nitrogen are commonly used to assess kidney function. This creatinine is a waste product that is produced by muscle metabolism and excreted by kidney. Normal range in men is about 0.74 to 1.35 mg per dl and in women it is about 0.59 to 1.4 mg per dl. Blood urea nitrogen, it is a test that measures the amount of nitrogen in blood that comes from urea. This urea is a waste product. Kidneys are responsible for removing urea from the blood. Normal level is about 6 to 424 mg per dl. Elevated levels of serum creatinine and blood urea nitrogen in blood indicate decreased kidney function or kidney damage. So these are the blood tests. Next one is urine test. Urine tests measure the levels of protein and albumin. Albumin is a protein normally present in blood but not in urine. Elevated levels of this protein and albumin in urine can indicate decreased kidney function or kidney damage. urine albumin creatinine ratio of more than 30 mg per gram could be a warning sign for kidney disease. So this is urine test. Next one is glomerular filtration rate or GFR. GFR is a measure of the rate at which blood is filtered by the kidneys. It calculates filtration rates and it is based on age, sex and blood creatinine levels. Normal GFR is about 90 to 120 ml per minute. GFR of less than 60 ml for more than 3 months indicates chronic kidney disease. That is glomerular filtration rate or GFR. Next is imaging tests such as ultrasounds, CT scans and MRI. These are used to assess the size, shape and structure of kidneys and this detect abnormalities such as cysts or tumors. Then biopsy, a sample of kidney tissue is collected for microscopic examination and diagnose certain kidney diseases. So these are about renal function tests. Next we will see pancreatic function test. Here various enzymes are estimated to diagnose pancreatic disease like serum amylase, which is about 28 to 100 IU per liter, serum lipase less than 40 IU per liter, then trypsinogen. Other tests for this pancreatic function include fecal tests, radiological studies, etc. So that is about pancreatic function test. Next organ function test is thyroid function test. Thyroid secretes two main hormones. These are T3 or triiodothyronine and T4 or thyroxine. The amount of T3 and T4 is regulated by the pituitary gland. If the level of T3 and T4 drops, pituitary gland reacts by secreting a hormone called thyroid stimulating hormone or TSH. This TSH activates thyroid gland to produce more T4. When the levels of T3 and T4 are high, pituitary gland stops secreting this TSH so that thyroid makes less T4. TSH is also called as thyrotropin. Coming to the thyroid function test, these tests include TSH, T4 and T3 tests. First one T4, which is done to measure the blood levels of hormone T4. Two types are there, total T4 and free T4. Total T4, which measures the entire amount of T4 which is attached to the blood proteins that helps to carry the hormone through the bloodstream. That is T4, total T4. Coming to free T4, it measures only the T4 that is not attached to the proteins. The results of T4 helps to diagnose hyperthyroidism or hypothyroidism. Next one is TSH test. This test helps to tell how well the thyroid is working. Next one is T3 total test. It helps to diagnose hyperthyroidism. Next one is thyroid antibodies test. These are used to diagnose Hashimoto's thyroiditis, which is an autoimmune condition. Usually two types of thyroid antibodies are measured, thyroglobulin antibodies and thyroid peroxidase antibodies. This is thyroid antibodies test. These are the normal values of TSH, T3, free T3, T4 and free T4. So this is about thyroid function test. Next organ function test is gastric function test, which include fractional test meal, pentagastrin stimulation test, augmented histamine test meal, insulin test meal and tubeless gastric analysis. This is gastric function test. So this is about organ function test. This is today's topic. Thank you for watching.